All right, thanks for joining us, guys. So today we're going to do a quick little patient testimony here. So I'm Annie. I'm the marketing director with Synergy Physical Therapy and Wellness, and then this is Colleen. She volunteered to come and do a patient testimonial for an expecting mother that we saw here at Synergy Physical Therapy and Wellness. So thanks for being here today. And so I'm just going to ask her a couple questions about her treatment, what kind of benefits she got from doing a women's health-based physical therapy, and then she's just going to tell us how she has been. We're at 39 weeks.
39 weeks and 4 days.
39 weeks and 4 days. So Colleen is ready any moment here. We're going to meet baby girl. So tell us a little bit about why you started doing physical therapy here at Synergy.
So I knew that Synergy already had a history or were known for being a women's health clinic, and
Right.
I already had some pelvic floor and SI joint dysfunction stuff going on before I was pregnant. So I wanted to kind of nip it in the bud, do a little bit of preventative care,
Okay.
and get started with PT right away, so that as my body started changing, my belly started growing, my ligaments started stretching out, that I would prevent myself from getting into all those bad patterns and pain again.
Right. Okay. So like Colleen said, she did kind of more of a preventative physical therapy. So what we kind of like to reach out to other people is that a lot of people don't start physical therapy until they are already hurting or they're injured. And we're just kind of trying to let people know that physical therapy is much recognized as a preventative medicine. And so like Colleen said, with her treatment, she was actually kind of doing not only treatment, while she is pregnant, but she's also doing preventative care. Since she's already starting to see some of those issues, she's just preventing them from becoming worse by kind of making them better beforehand. So what kind of treatments and exercises and different kinds of things did you get to do here at Synergy?
So the good thing about starting really early was I was able to try pretty much a little bit of everything. So from just the normal stretching and exercise strengthening, mobilizations for the pelvis, and regular massage therapy. I was also able to do internal pelvic floor release. I was able to do dry needling, but biofeedback. We did abdominal release work. Okay. So I pretty much got to try a little bit of everything.
And the hypopressives in the
and we
beginning,
did some hypopressives. Actually, more towards the end, just without like the vacuuming part of it.
Okay.
So I got to try pretty much like all the different techniques that are offered, which is really cool.
Yeah.
And was like really beneficial throughout, because everything, we did different things at different stages depending on like where I was and like what we were allowed to do and things like that.
Did it surprise you like how much you were still able to complete like towards the end of your pregnancy,
Yeah.
like last couple of weeks?
So now that we're getting towards the end, like I said, I started as a preventative measure, and it worked because I never, like, as my body started changing and things like that, we were able to get my pelvis really stable before I started getting like big belly. Mm-hmm. So I actually stayed stable as my belly started getting bigger, where in the beginning it was a little bit more unstable, but because we did a lot of the strengthening and things like that, it helped. I had virtually no low back pain at all.
Wow.
And the only pain I ever really get or have is more like mid back, and that's more just from like standing after a long day and stuff like that.
Okay.
And then even with that, if I could just go through some of my like gentle stretching and exercises, I can get it to chill out.
Cool. Very nice. So it's nice that Colleen got to kind of dip into like all the other kinds of things that Synergy has to offer. So while we're only we're not only a PT based clinic, we also offer all kinds of different wellness services, like she mentioned, like massage therapy, and we're starting this hypopressive low pressure fitness too, which just kind of reduces some of the pressure on her pelvis and some of her core. We talk about that in some of our other videos. It's nice that she got to try, biofeedback and dry needling. She has to do all these different kinds of measures. So, and it sounds like it's been pretty beneficial for you. So what do you think of all these different kinds of treatments? What do you think is the most beneficial part of doing like women's health-based physical therapy?
So, like I said before, I feel like, of course, in this particular situation, starting early is key, because the earlier you start, the more you can do. As you get later on in pregnancy, there's less things that you're allowed to do. Okay. So in the beginning, we were allowed to do a lot of like the internal pelvic floor release work, which I think was really beneficial, one, helping the pelvis get stable, but we were able to get a lot of the trigger points out, and then helped like as the pressure on my pelvis started increasing as the baby got bigger, I didn't have as much pain, more just like pressure. Okay. And then a lot of the abdominal release work that we did and then like strengthening on top of it was really beneficial because as of right now, I am not showing any symptoms at all of diastasis recti, which is a big pregnancy thing. You know, it's the splitting of your abdominals. As of right now, I don't have any split at all.
Yay.
So, and as the baby comes out, that should pretty much stay that way.
Oh, good.
Which
So
is
core stabilization was like a
big
big
part of it. Yeah. The core stabilization and the abdominal release work together was like a huge thing.
Yay.
We also did, which I didn't mention before, we did a lot of diaphragm release, which for a lot of people, breathing gets really hard as all the pressure on your diaphragm comes in. So, I mean, as your belly gets bigger, it's a little bit harder to get in there. But before my belly was really big, we were able to get in there a lot, and it helped me not have as much of like the breathing problems. Like I still get out of breath easily, but that was like not as bad as it could have been, I think.
Cool, very nice. So do you think that you would recommend Synergy to other expecting mothers?
I think, yeah, definitely, because they cater specifically to women's health, you know, in addition to everything else, but they have just a better understanding of what you're going to need coming into this as like a pregnant person. And there's just the knowledge there and like knowing, you know, what you're allowed to do, what you're not allowed to do, depending on like where you are and things like that. Makes a big difference versus if you go somewhere where the knowledge isn't as much, they might be afraid to do something with you that you actually are allowed to do, or they might not be willing to allow you to do some of even like the strengthening exercises, like some of the stuff that I'm still doing. If you were to go somewhere where they didn't know, they might even let you try it, where you know, you can, if you have that knowledge, you know what the person is able to do.
Right.
You don't have to be afraid of like letting them do whatever they're capable of doing.
Right. So if like an expecting mother were to go to like a sports physical therapy clinic, the clinicians there might not be as knowledgeable or experienced working with like expecting mothers, so they might be hesitant to put her through some of the exercises, balance stuff, you know, even perform some of the other things that we did in early pregnancy, like dry needling or the abdominal work. Yeah, internal work. You know, they might be a little bit more hesitant, where since we see those kinds of clients and like we specialize in the women's health, it's a lot nicer and more comfortable for expecting mothers to come here because they know what their limitations are and then where they aren't and all the things that they can do. I just wanted to say I actually stopped into some of Colleen's treatment and I got to see some of the exercises she's doing, and it just blows my mind that, you know, 39 weeks and she's standing on a Bosu ball 1 foot, you know what I mean? There's all kinds of crazy things that she's still able to do with a stable core and maintain balance, so you can definitely see the progress and the stability. So we're glad to see that it's been helpful and beneficial for you, and we're all very, very excited for you. Only a few more days now, and so I just wanted to say thank you again for joining us with the testimony, and I hope some of you guys got some good answers and got a little bit of a view of this. If any of you know anybody who's expecting or plan on expecting in the future, or want to be preventative to your health in any kind of way, just know that Synergy is always here for you, especially with anyone who has women's health questions. You can always put it in the comments below, or you can send us a direct message on Facebook or here on YouTube, and we should be able to get back to you within about 24 hours, or you can always give our office a call, and we can answer any questions that you have, get you in for physical therapy, and hopefully get you as core stabilized, strengthened, and ready to go like Colleen. So thanks again for being here.
Yeah, definitely.
And hope you guys all have a great day, and again, let us know if you ever need anything. Thanks.